In 1965, federal actuaries figured the Medicare hospital program would run up about $9 billion in 1990. The cost was more than $66 billion by that time. In 1987, Congress estimated that the Medicaid special hospital subsidy would hit $100 million in 1992. The actual bill came to $11 billion. Researchers at Dartmouth Medical School estimate that 30% of Medicare spending does nothing to make beneficiaries healthier or happier. The Department of Health and Human Services reports improper Medicare payments of about $12.1 billion in 2001. All of that money was practically stolen from the government because it isn't nearly as careful with our money as we are. According to Medicare's trustees, the ratio will fall from about 12 workers per beneficiary in 2003 to about 2.4 workers per beneficiary in 2030, and will continue to fall until there are only 2 workers per beneficiary in 2078. Medicare's trustees estimate that Congress would need to put over $80 trillion in an interest-bearing account in 2008 to cover those future funding gaps. In 2008, the entire economic output of the United States was less than $15 trillion. We can't afford that. It's literally impossible. All of this spells out a huge problem for the U.S. and leads to the inevitable conclusion that nationalizing our healthcare system is the very last thing the U.S. should do under any circumstances. Medicare by itself is completely unsustainable. It's just not reasonable to give the government any more responsibilities when they have messed up this badly on a smaller project. And finally, we should note a couple last reasons for why private medicine and insurance rates have been rising as of late. A couple important reasons for the rise has been due to Medicare. First off, Medicare increases demand for health services, and this extra demand raises the cost on all medical services and products. Secondly, Medicare directly increases the cost of private insurance because on average it pays less than the cost of services hospitals provide, and hospitals are unable to negotiate those prices. That shifts the costs for Medicare and Medicaid to the private insurance providers. In 2005, Medicare and Medicaid paid over $25 billion less than what those services actually cost hospitals to perform. Every penny of that had to be charged to private insurance companies. Another contributor to the high and rising costs of healthcare are the 30 million elective surgeries performed on Americans that do absolutely nothing to improve healthcare, but cost a pretty penny and further increase demand for medical services, and most importantly, the continuously growing American waistline. Yet more reasons for why private insurance costs so much is that we cannot buy generic drugs, and we can't buy insurance across state lines. That is pure protectionism and only serves to hurt the consumer. If you are still hell-bent on socialized medicine, then I probably can't convince you. But I at least have a couple of suggestions for you. First off, don't have the federal government handle it. Massachusetts didn't do a great job either, but it was much preferable to the way the federal government handled Medicare. Also, states can experiment with differing systems to find out what works best, whereas the federal government is trying to push a massive, all-encompassing system through Congress that no one has even completely read, and it won't allow for any experimentation. There really is no reason to leave it to the federal government. States can handle their own health care just like individual countries do within the European Union. Secondly, we should focus on health and fitness, not medicine. America's main problem is their diet and lack of exercise. If we could just match Japan's diet and health standards, our healthcare costs would plummet, while their life expectancy could very well retire than anyone else's. That's it for tonight. What do you guys think? Is nationalizing medicine an insane plan, or am I the crazy one? I look forward to hearing all of your ideas on the subject, and I'm looking forward also to your help in saving the world. Peace out, everyone.